Hi, everyone. This is Dr. Samantha, and welcome to another live Q&A session here that we have every Monday at 9 p.m. Eastern Standard Time. I'm here to answer all of your questions that you have submitted onto our videos this week, as well as any questions that you may have live here in the chat. So please feel free to put anything that you have into the chat for us. And remember, we really appreciate all of your support. Please like and subscribe to the channel. It really helps us out. And I'm going to go ahead and I'm going to get us started. We had a lot of great questions tonight. So we usually get a lot of questions every single week on pregnancy and bleeding. And this is a very hot topic because bleeding during pregnancy is very, very scary. So we want to make sure that, we're okay when we're a pregnant woman, and having bleeding is just really, really hard to handle. So I like to answer these questions because it's so important to understand that there's many reasons why you might have some bleeding and everything is still okay. So the first question came in. I am worried since I am somewhere between 5 and 6 weeks, but as of last Tuesday, I started spotting brown discharge, and 2 days later, I had a red period like bleeding begin. It's already been 3 days of red bleeding. Cramps are super minimal, but I did see clots yesterday. I wonder if I'm having an early miscarriage or the cervical polyps that you mentioned. I did have an ultrasound when I was barely going to be 5 weeks, and they said they didn't see anything in the uterus, no sac or anything. The only thing they saw was cysts in my cervix and one on my ovary. Do you have any suggestions? So this question actually gives us a lot of information to work with. So for starters, this question talks about two different colors of bleeding. So the first color she mentions is she mentions brown bleeding, and then the second one she mentions is red bleeding. So brown bleeding is usually a sign of old blood. So this is blood that has resolved, and this, generally speaking, can be a good sign. Now, red bleeding, bright red bleeding, this is something that we get a little bit concerned about because bright red bleeding can indicate an active bleeding source, which could be a problem. Now, when you have a change like what she describes, where she goes from brown to red, this is something that you want to contact your healthcare provider so that they can investigate. Now, another kind of bleeding or another color of bleeding that you can experience is pink. So pink is a sign of spotting. So this is usually like red bleeding that's been mixed with some discharge, because there is normal discharge coming from the vagina when you're pregnant. Now, all three types of bleeding should be taken seriously. However, there's a lot of normal causes of bleeding. For example, implantation bleeding, which is when the fertilized egg implants into the side of the uterus. At this time, the uterus may bleed a little bit, and that may be what you see coming out. You can also get bleeding from sex. The tissue of the vagina gets very thin and dry during pregnancy because the hormones that support pregnancy cause this. So as a result, sometimes after sex, you could have some bleeding. Now, one of the things that this patient mentions is that she had an ultrasound at 5 weeks and it didn't see anything, not a sac or anything. So what you need to understand is ultrasounds can be done very early, but they're not always accurate at that time. So at that time, it is very, very common for an ultrasound to be inaccurate. Now, it's hard to say why a sac might not be seen and a pregnancy would still maintain itself, but it does happen. So I want you to know that this can happen and you still may have a healthy pregnancy. However, seeing clots afterwards is a warning sign that you need to take seriously. So for those of you who don't know, clots are like little pieces of blood. Sometimes they can look very round and circular like a coin. Other times they may look like flaky and like long strings. This is usually pieces of the uterine wall that are coming off. This is very common during during your period. But it's not really a good sign when you've had bleeding this early on and you're pregnant. It is usually a sign of miscarriage. Now, what can you do to figure this out? For starters, try to take a home pregnancy test, okay? Home pregnancy tests are one of the easiest way for you to figure out whether you're still pregnant. However, sometimes a home pregnancy test will be positive and you are still having a miscarriage. So the way we figure out that is we need to do a blood test. So we test for a chemical called HCG, human chorionic gonadotropin, in the blood. And what happens is this should go up as you get further along in your pregnancy. So your number just keeps getting higher and higher and higher. When you're having a miscarriage, that number goes down. So if we suspect a miscarriage, oftentimes a healthcare provider will order the HCG blood test. And then like 2 or 3 days later, we'll do another one. And we compare those two results. And if the level is going down, this is a sign that you had a miscarriage. Now, if you're not sure, you want to go ahead and make sure you continue to treat yourself as if you were pregnant. So what does this mean? This means don't drink alcohol, don't use illicit substances. You want to make sure that you're treating your body as if you are still pregnant until you know otherwise. This is for the health of a potential baby that you might still be pregnant with. Now, the only other thing that I want to say about this is she mentions, is it possible this is from cervical polyps? She says there were cysts noted on the cervix and on the ovaries. So cysts are usually balls of fluid. They can look kind of like a grape or something on different parts of your organs, including the ovaries. They're very common. They're usually benign, nothing to really worry about. The biggest thing with ovarian cysts is they can burst, and that can cause some pain. Now, cervical polyps are more like a piece of tissue, like a solid piece of tissue that's attached by a little piece of tissue to something. And so in this case, it's the cervix. And a cervical polyp can get very irritated and bleed. However, the ultrasound should have shown that you had cervical polyps because these are more solid versus cervical cysts. So I doubt that's what's going on. But in this person's case, the most important thing to do would be to get checked out by a healthcare provider because further testing really needs to be done. Now, the next question that we have about bleeding during pregnancy came in, and it says, heavy bleeding runs in my family. What lifestyle changes and supplements can I take to make sure I carry my baby? So this is an excellent question. One of the things that I would be saying though, is it heavy bleeding after you give birth or heavy bleeding during the pregnancy? So heavy bleeding during the pregnancy can actually happen. It is something that is not common, but it does happen, and women can carry healthy babies. The biggest risk with having bleeding during a pregnancy is anemia. If the placenta, which is the organ that feeds the baby, if the placenta is solidly attached to the uterine wall and the baby is growing normally, it doesn't matter if you're bleeding from other places. The biggest thing though is you can't be anemic. So what is anemia? And we have a video on this that we can link into the description. But anemia is where you have a lack of red blood cells. Red blood cells are the cells that transport oxygen and nutrients around your body. Okay. So when you don't have enough, it can lead to a whole bunch of symptoms. And one of the things that happens is you don't transport around enough nutrients and oxygen. Well, not only is that affecting you and your cells, but it's also affecting the baby. Okay, so the baby gets less nutrients and less oxygen. The placenta doesn't function as well, which means your baby may not grow as well. And if left untreated, this can lead to preterm birth. Additionally, if you go into delivery and you're anemic and you bleed out, you have a postpartum hemorrhage, this can actually put you at higher risk for very serious complications. So what can you do? For starters, if you aren't pregnant yet, you want to go and talk to a hematologist. You want to let them run all the tests they can. You explain that you have this history. And the hematologist can do stuff not only to run basic anemia labs, but to run stuff like your ferritin storage and your total iron blood count to see where are things at, okay? If you have certain vitamin deficiencies like B12 deficiency or folic acid deficiency, this can also affect whether you're anemic and how well you respond to treatment. So they can look at all of these supplements and decide that they want to go ahead and take care of it before things start. Now, one of the things you can do is you can talk to them about what kind of supplements to take. Now, the most common thing that people are told to take is iron supplements, okay? Your traditional ferrous sulfate. And the thing is that what most people aren't told is that iron is best absorbed with vitamin C. So when you take your iron supplement, you want to make sure you're taking it at the exact same time you take some vitamin C. So this means if I'm taking iron, I chew a chewable vitamin C at the same time, or I drink it with a glass of orange juice, or I eat a piece of citrus fruit with it. This can help ensure that you absorb the maximum amount of iron that's possible. Now, if this person was talking about postpartum bleeding, that's a different story. One of the things you want to talk to your OBGYN about is your feelings on a blood transfusion, and making sure that if you are open to a blood transfusion, that you have a blood ready in the delivery room, whether it's a vaginal delivery or a cesarean section, before you give birth. Because if the blood is sitting there ready to go, that is way better for any emergency situations than having to order it and wait for it. Additionally, you want to make sure that you're hydrated. Whether you bleed during pregnancy or after pregnancy, you want to make sure your volume is up. And again, pregnant women tend to not drink a lot for a variety of reasons. For one, pregnant women go to the bathroom all the time, and so they don't want to go to the bathroom all the time, so they try to avoid drinking as much water. Another reason is because your baby is pushing on your stomach and there's just not a lot of room there. And so some women will have nausea, and as a result, we don't drink as much. But dehydration leads to preterm birth and can affect conditions like anemia. So those are some of the things that you can do with that. Now, kind of sitting in the same realm is RH factor, rhesus factor. So we got a question this week that said, what if a woman is RH positive and her husband is RH negative? So what is she referring to? Rhesus factor is what tells us whether we're a positive blood type or a negative blood type. So there's O, A, B, and AB blood types. And everybody is either, say, O positive or O negative. They either have a rhesus factor that's positive or negative. Now, when a woman has a rhesus factor that's negative, for example, she's AB negative, that means that she does not have the rhesus factor. And if she gets pregnant with a baby that is rhesus factor positive, which is possible, then what happens is if that baby's blood gets into her circulation, which it usually does, and her immune system sees it, her immune system will start to build antibodies. It creates like an autoimmune response. Now, the first time your body is exposed to Rh positive antibodies, it doesn't really do anything, okay? It's not a negative effect. Your immune system finds it and says, this is a foreign invader. We need to figure out how to fight it. And it starts to figure out what its immune response will be if it ever gets exposed again. Now, what we found is the next time you get pregnant with a baby who is Rh positive, if there's no treatment, your body will attack that baby. So what is the treatment? The treatment is RhoGAM, which helps to eliminate this antibody response. Now, if a mom is Rh positive and her baby is Rh negative, she does not need to get the RhoGAM shot because her body does not perceive that Rh negative blood as an invader. It's only when it's reversed. So there's no reason for you to receive this medication if this is the scenario. However, if it is the other way around, you should be receiving the medication around 28 weeks of pregnancy. And again, postpartum, if the baby has a blood test that shows the baby is Rh positive. If you are an Rh negative woman and you have any miscarriages, you also need to receive the RhoGAM shot every single time. It is that important because if left untreated, it can cause miscarriage in future pregnancies. That's a good question. We usually get some questions on antibiotics. And I think this is a really good topic that a lot of women get really nervous about. So we got a question this week. Hello, I'm 16 weeks pregnant. And I took erythromycin. It gives me stomach pain and a little bleeding. Please help me. Should I continue or stop? So erythromycin is one of many antibiotics that you could be given during your pregnancy. Antibiotics are used to kill bacteria, okay? They won't work on viruses. They won't work on fungus. They won't work on yeast. So it's only used for bacterial infections. That's all it's going to work for. Now, antibiotics, they kill off bad bacteria and good bacteria, which is why for a lot of women, when they take an antibiotic, they end up vomiting, diarrhea, very nauseous, stomach upset. And so the thing is that when this happens, it can cause a lot of issues, including stuff like stomach pain and like other things associated with like gas pains, bloating and stuff. However, it should not cause bleeding. Okay. So I want to make sure that everyone is clear. If you are given a medication, even if you're not pregnant, medications, generally speaking, should not cause bleeding. So if you are experiencing bleeding, you should contact your healthcare provider immediately or go to the hospital. So this could be a sign that you've developed an ulcer. Okay. So an ulcer is a hole in the lining of your stomach or your intestines, and it can bleed. And if left untreated, this could cause serious issues for you and the baby. So bleeding is not normal with erythromycin. Now, I don't want to just say stop the medication. You need to get medical help. Okay. So you're being given an antibiotic for a reason. And these antibiotics are treating infections that, if left untreated, can lead to preterm birth, miscarriage, stillbirth. They could also lead to sepsis in you. So if they've given you an antibiotic, that antibiotic probably needs to be replaced. And if you're severely ill at this point, that may mean that you need hospitalization for further treatment of your illness. So I'm not telling you to stop. I'm telling you to seek medical attention. However, stomach cramping can be normal, but again, at this point in time, you should be speaking with your healthcare provider. Now, another question we got was, I've taken doxycycline for 2 weeks while being 2 weeks pregnant. Is this bad? So one of the things that I'm doing right now is I'm looking at a special medication guide that providers use for pregnant women. So your healthcare provider should be accessing resources that give the most up-to-date information. And it's important for you to know this, because it's this is where we get the ability to give you guidelines. Now, one of the reasons why I wanted to look this up, and one of the reasons why this particular viewer is so concerned, is that doxycycline is known to cause birth defects in babies. So it has been positively identified to cause birth defects. The most common effects are fetal bone deformities and also tooth deformities. Okay. It is very unlikely to help a mom as much as it could harm a baby. There are a few exceptions to this, okay? So, like, for example, Rocky Mountain spotted fever, anthrax are 2 infections, very rare, but we might decide that it's better to use doxycycline and take the risk with the baby. Now, everything is time limited. That's one thing you need to know. So it's dose dependent on time. That means the longer the baby is exposed, the more risk there is. Yes, it is important for everyone to understand that at 2 weeks gestation, it probably wasn't the best time to be exposed, but it is done at this point. For anyone who hasn't taken doxycycline, if you can try to avoid it, you should. It is not considered safe. Now, for this mom who's taken this medication, what can you do at this point? What you're going to do is you're going to talk actively with your healthcare provider. Make sure you're taking a prenatal vitamin. Make sure you're hydrating. Make sure you're not doing anything like smoking or drinking. Keep yourself as healthy as possible. Give your baby the best chance in every other aspect. And then once you see your provider, ask them to refer you to a maternal fetal medicine physician. Maternal fetal medicine physicians are the doctors that take care of women who have high-risk pregnancies. These are the doctors that can do all the tests to determine if there were any adverse effects because of the doxycycline. So these are the people you want to rely on to figure out how the baby is doing, okay? And, this is one of those things that highlights why it's so important to try to figure out where to get good sources of information on medications. So, for example, you want to make sure that you are seeking out information from other providers like pharmacists. If you're not sure if your healthcare provider has given you enough details or you want to double check their information, pharmacists are also highly trained in medications that are safe for pregnant women. So that was a great question. For any of you who are joining us, welcome to our live Q&A that we have here every Monday at 9 p.m. Eastern Standard Time. Please feel free to put any questions that you have into the chat. So we got a question this week. How long does a cesarean section? She says, how long does a spinal surgery last for? And is a spinal safer? Okay, so a spinal, she's referring to anesthesia. So there's two different types of anesthesia that are the most commonly used during a C-section. And it's an epidural and a spinal, okay? So what is the difference? The epidural goes into the epidural space. The spinal goes in a slightly different spinal space, okay? The spinal is exclusively used for a C-section where no epidural is already there, okay? So if you are going to have a vaginal birth, they attempt to do an epidural, which they will then use in the course of a C-section. A spinal is just slightly deeper, not deeper. It's like in a slightly different space that allows them to administer the medication in a slightly different way because they use different medications for your C-section than they do for a vaginal birth. Epidurals nowadays are very light, okay? So a lot of people, all they think about when they hear about an epidural is what they see on the movies, where they see that the person can't move and all these jokes about how they can't walk around, they can't feel anything. That's not the case anymore. In fact, just so you know, with your epidural, you're very likely to feel some discomfort. I need y'all to realize this, and most people don't. We don't want you to be so numb you can't feel anything. Because if you're so numb you can't feel anything, more often than not, you're not able to push and you end up with a C-section. So instead, we need you to feel some. We also need you to feel your legs so we can move you into different positions that may allow for you to deliver your baby better. For example, believe it or not, being on your hands and knees is a very great way to deliver a baby. But you can't be on your hands and knees if your legs are numb, okay? So what you want to do is you really want to make sure that you understand that. But in a C-section, a surgery, you definitely don't want to feel anything, and that's why it's slightly different. Now, how long does the spinal last? 12 to 18 hours is generally speaking what happens. Some people it's a little bit longer, some people it's a little bit shorter, but generally speaking, your spinal is going to last for 12 to 18 hours. Now, that does not mean you have something in your back for 12 to 18 hours. That means that the medication lasts that long, okay? Which is kind of nice because the first 12 to 18 hours, you really don't want to be getting out of bed and moving too much. This is also why after a C-section, they keep you in bed for so long because for a C-section, you're much more numb for a while afterwards and your legs can be weak for a little while. Now, how long, so I don't know if she was asking if a spinal C-section surgery takes longer. It doesn't. The only change in the length of time of the procedure is the fact that if you don't have anything when you get back to the OR, the operating room, then they have to put it in. So that's the only difference in timing. Now, is a spinal safer? I am going to tell you that it probably is neutral. It's probably the same. It's a slightly different space. It's not really a different technique. It's not even a different kit. I've seen both done. They're basically the same. And so I would say that one is not more safe than the other. The only exception to what I just said there is if you have some kind of spinal deformity or spinal injury, such as bulging discs, that changes the alignment of your spine. That may dictate what type they will use on you, meaning an epidural or a spinal. So that was a great question. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor, and we are here for another one of our live Q&A sessions that we do every Monday at 9 p.m. Eastern Standard Time. So we got a great question about carpal tunnel syndrome. I'm 13 weeks pregnant and the carpal tunnel pain is excruciating. I warm wrist braces and they've stopped helping. It completely interrupts my sleep, ability to drive, cook, write, etc. So carpal tunnel is extremely frustrating and it can be extremely debilitating during pregnancy. People think carpal tunnel is not that big of a deal. It can cause excruciating nerve pain throughout the hand and the wrist. So this is the carpal space. It's like a tunneling space in through your wrist. And when you have compression here, it causes this pain because it compresses on that nerve. Now, the way that we treat this usually is to do a tiny little surgery here where we basically release this band of tissue that opens up the carpal space. The problem is nobody's going to do carpal tunnel surgery on a pregnant woman. We're not going to expose a baby to anesthesia for that type of procedure. And it is a procedure that requires anesthesia. So there's very limited things that we can do for this. For one, we can use braces. And in this case, she says that the braces have stopped helping. But one of the things I tell people is make sure that you're getting your hand braces, your wrist braces, from a carpal tunnel specialist. This is where a lot of women go wrong. They go to their OBGYN, they tell their OBGYN what's going on. OBGYN says, oh, I've seen this a million times, because they probably have. It's carpal tunnel syndrome. Get some wrist braces. The carpal tunnel is very, very specialized, and it's not always going to respond to a standard wrist brace just out of the store. Instead, you want to go to a specialist who's been diagnosing this forever and can give you the proper brace. Additionally, that brace may need to be adjusted as your pregnancy progresses if you're having any kind of swelling or anything. Now, what else can you do? So, invest in some technologies that will limit the amount of use of your wrists. So a lot of people develop carpal tunnel because of typing, and they type in this position where their arms are like this and they're typing and typing. And what happens is it puts pressure on that space. Okay. So that's why we have all these ergonomic keyboards that put your hand into this position to type, because it's putting the least amount of pressure here. That's also why you see those mouse pads with that gel area to rest the wrist on. That's designed to help give your wrist some relief. So those are some of the things that you can do to help with your carpal tunnel. But additionally, use text to speech. So a lot of us use our cell phones for a lot of stuff. There are speech to text. I apologize. Speech to text features on our stuff where you can actually speak into the microphone and it will type it out for you. That can eliminate a lot of the typing that you might need to do. And additionally, there are some medications you might be able to use. For example, Cymbalta is an SNRI, serotonin norepinephrine reuptake inhibitor. It's a group of medications we use for anxiety and depression, but they can also help with pain, and they're non-addictive. And this might be a very awesome option for you to use throughout pregnancy until you get to the end before you deliver. They're usually safe for the baby. They don't have a lot of risk factors. And honestly, if you're in so much pain, you might not be sleeping well, you might not be eating well, and that can really affect the baby in a negative way. So taking a little bit of something like Cymbalta might help. So yes, and other than that, it really sucks to have carpal tunnel. It's a very hard thing to have. So our next question came in and it was about urinary tract infections. So I'm in the early stage of pregnancy and I have a urinary tract infection. How can I cure it, or can it cure itself? So, urinary tract infections are one of the most common infections a woman will have while she is pregnant. And it is extremely important for you to understand, if this is left untreated, this can lead to maternal death from sepsis. It can lead to infant death through sepsis. Okay. So, what is a urinary tract infection? So, you have the bladder, and the bladder is what holds your urine, your pee. Okay. And it comes out through the urethra, which goes out by your vagina. That's your pee hole. Okay. So for women, it's very short. So if we don't wipe or clean ourselves properly, then bacteria can just climb right up into the bladder. Now, in the bladder, we have a baby that's pressing on there, okay? So what happens is, even though we try to empty our bladder and get all the pee out, some of it sits in there. And if it's in there for too long, it can actually allow the bacteria to grow and grow and grow, causing a urinary tract infection. Now, if that is left untreated, that will continue to grow. And then out of the bladder, there are two tubes called the ureters, and those go up to the kidneys. So that bacteria will travel up those ureters up to the kidney, and it causes a kidney infection. And this is also called pyelonephritis, which leads to sepsis. Urinary tract infections can cause miscarriage. It is extremely important that you get them treated. Now, it's also important that they get diagnosed properly. You cannot just assume you have a urinary tract infection because you've gotten a million of them. You need to have it tested by your OBGYN or midwife to make sure that's what it is. And then you need to let them decide if they want to put you on antibiotics. So, how is it treated? Usually antibiotics. That is the most common treatment. So, it's a bacteria. So, what they're going to do is they're going to take a urine sample from you and they're going to test it. And if they find bacteria, they're going to send that to the lab, right? And they're going to put it on a dish to grow it. And they're going to test the different types of antibiotics to see which one will kill it fast. While we're waiting for that, we're going to give you an antibiotic that will most of the time work to kill that infection. If we start you on an antibiotic and we don't change that antibiotic, you need to take the entire thing. So antibiotics work very quickly to start killing down bacteria. So we start to feel better really quickly. So then what happens is a lot of women stop taking their antibiotic. Don't do this, because the bacteria that's still left there, they can become antibiotic resistant. This means that the regular antibiotics will not kill them. So, but what also happens is they're still there. So once you stop taking that antibiotic, they go ahead and they start multiplying again. And the next thing you know, you have a full-blown urinary tract infection that now won't respond to the antibiotics you were given before. So make sure you're taking all of the antibiotic as directed. Now, can it cure itself? One of the things that we tell you to do is drink lots and lots of fluid, okay? Because if you can pee out the bacteria, that will eliminate the infection. So, can it cure itself? Maybe. How does it cure itself? It would cure itself if you are not symptomatic enough to go to your healthcare provider and get tested. So, what do I mean by that? I mean, maybe you're starting to go to the bathroom a little bit more than normal, which is one of the signs of a urinary tract infection. So, what do? You start drinking and drinking and drinking and drinking, and that goes away. And then you're like, oh, okay. And you feel better and nothing ever happens. That might be a urinary tract infection going away. Another sign of urinary tract infection is burning when you urinate. So you wake up one day, you have a little bit of burning the first time you urinate. So what do? You drink and you drink and you drink and you drink, and nothing ever happens after that. You feel fine. That could be a urinary tract infection that was this close to really fully developing and it went away. However, if you're symptomatic, if you're going to the bathroom, leaving, going back in 10 minutes because you feel like you need to go, but there's nothing coming out, if you're having pain, if you're having blood in your urine, if you're having fever, if you're having any symptoms, you need to get treated by your healthcare provider. And if you present and he says you need an antibiotic or she says you need an antibiotic, You need to take all of the antibiotics as directed. For any of you who are joining us, thank you so much for joining us. Please remember you can put in your questions into the chat. So I got a comment. I got actually a couple comments this week from some partners. I believe both of these were male partners. The first one came in on the postpartum depression in fathers. And so this question was, or it wasn't really a question. He wrote, I just had a baby 2 weeks ago, and I'm so depressed right now. Most therapists suck. And sorry, he said, I'm so depressed right now. So I responded to him and I said, if you're needing help, please seek out therapy. It's one of the most evidence-based ways of doing it. And he said, most therapists suck. They charge $80 an hour for things that I could have found on YouTube, like this video, for example. And I thought about that, and I thought this was a great place to kind of talk about this. So postpartum depression in fathers, and I'm going to say in fathers and in partners, is a real thing, okay? So one of the things you got to understand is postpartum depression is more about the adjustment to having a baby and sleep deprivation. These are the two big factors to postpartum depression. And this is why we're learning that it happens in partners as well as birth mothers. So in partners, up to 50% of partners will develop postpartum depression if the mom also has postpartum depression. 10% of fathers will develop postpartum depression on their own, even if their partner doesn't have anything, and many will require medication. Now, postpartum depression in partners looks very different than it does in moms. It's oftentimes manifested in irritability and anger. Some people will throw themselves into work. They'll have ruminating thoughts about the future. Have we figured out the finances? Have we figured out how to pay for college? Have we figured out all of this stuff? They will oftentimes feel that they're not doing enough or contributing enough, and they're doing everything that they can to contribute. They also tend to micromanage things that are not directly related to the baby, which can frustrate the mom who's thinking, I need help with the baby right now. And what she finds is a partner who is micromanaging the kitchen, because she's not recognizing that when he wants, say, the kitchen to be clean, it's because he's worried about germs around the baby. It's a very different process. So you're a guy with postpartum depression. What do you do? And I'm saying a guy because this was a guy that asked. For starters, there's a postpartum depression support group that is online and done through Postpartum Support International. Postpartum Support International is one of the best resources that you will ever find. They're the ones who provide a lot of specialized training for a lot of us clinicians who are in this field. So I'm perinatal mental health certified, and that comes from Postpartum Support International. Their support groups are free. They have support groups now like 7 days a week. They have support groups for military families. They have support groups for LGBTQ partners. Everybody that you could think of, they have a support group for, and they're free. And I would encourage you to start there, because you're right. Not every therapist is going to be fantastic. And this is a resource where you can get together with other men or other partners and talk about your experience. Now, secondary to that, of course, you need to be there to support your partner. And I encourage you to use the same advice I'm about to give you for her. You need to take care of yourself, okay? You need to have fun. One of the biggest things that happens after we have a baby is we're so focused on, making sure the house is clean and eating good foods and social media is perfect and cleaning that. It's none of that's worth anything, okay? You can eat McDonald's 24/7 and you can eat off of paper plates and nobody cares if you wash towels or sheets. The Department of Children's and Family is not coming after you for those things, okay? But if you go cuckoo crazy because you aren't taking care of yourself, that's going to be an issue. So if you like video games, play video games. If you like to take walks, take walks. Whatever it is that you like to do, you need to make sure you're taking time to do it. Now, this is going to sound overwhelming at first. You're saying, Dr. Samantha, I don't have the time for this. I now have this creature that runs my day and my night. I barely sleep. I barely eat. How in the world am I supposed to have fun? Okay, so I am not telling you you have to have 4 hours of fun every single day. What I'm telling you is you need to learn how to incorporate it into your lifestyle. For example, one of the things that happened when our daughter was first born is my husband and I like to play video games. So we have one of those breastfeeding pillows. And sometimes when he was taking the baby for me so that I could do something else, what he would do is he would take that pillow and put it around his waist, and he'd prop her kind of on her belly, and she'd be resting on that pillow, and he'd wrap his arms around her and he would play video games. So in essence, he was holding her. She was practically skin to skin. She loved it as a newborn, and he got to enjoy himself. And I was able to sit down and be able to relax, like to just not have to worry about holding a baby. This is one very unique way of working within the guidelines of we need to help each other. How can we do this? A lot of patients, they like to go to the gym. Go to the gym. One of the things a lot of gyms have now are daycare centers that are included in the price of your gym membership. Bring the baby with you. Baby goes to the daycare, you go to the gym, your partner can be at home and maybe just taking a nap. Whatever it is, look for the creative way to enjoy that. I can tell you when our second one was 3 weeks old, we took our kids to a basketball game, a Miami Heat game, because we had free tickets. And I was like, why not? Enjoy your life. The things that we see around us don't have to be the way you imagine it. And I think that's the first thing. Think outside of the box and things will look better. The other most important thing is you need to connect with your partner. Okay. When I see a lot of wives and husbands and partners that are suffering from postpartum depression, one of the biggest things they complain about is having that connection that they had lost. When I tell couples when they're going home from the hospital, I would tell them, make sure somebody you trust is waiting at home. Hand them that baby. Okay. Make sure that if you're breastfeeding, they'll let you breastfeed. They'll wake you up for that. If you're formula feeding, tell them to have fun. And the two of you go take a nap together. First of all, because you're tired. And second of all, because this reestablishes that you guys are in this together. And that's also important. Everything else, it doesn't matter. The house can stay as dirty as it wants. That stuff doesn't matter. What's most important is your mental health. The other thing I'll tell this dad from a medical standpoint, make sure that you go ahead and get checked out by your healthcare provider. Let's say you had some pre-existing anemia before you had the baby. Anemia can lead to symptoms of depression and anxiety. So if you already had pre-existing anemia and then you start to feel depressed after the baby, the anemia could be making it worse. So getting yourself checked out from a medical standpoint can also rule out anything that might be going on that could be corrected easily. Another question or comment we got was from the partner support video, and it said, what if I feel like jumping out the window when my girlfriend's mood swings start? Okay. So mood swings during pregnancy are a very hormonal thing. Okay. Very much hormonal driven. Sometimes a little bit of insomnia will certainly make it worse, but there's pretty much nothing else but that causes it. Now, the thing is, it's very challenging to deal with because she gets upset, she feels out of control, and she already feels out of control. Even if she doesn't realize it, her body's changing, things are just changing, and she can't stop that. So it makes everything very intense for her, and it comes out in intense mood swings. So I will encourage you to walk away. Okay? That's the best thing I can tell you to do. Not walk away from the relationship, walk away from the argument. Okay? You try to speak in a calm voice, ask what she wants, ask what she needs. One of the biggest mistakes people make, for example, is during that time, a woman will say, I don't want anything. Okay, walk away. Okay. Now, at first, she's going to get very mad at this because most of the time she does actually want something, but she needs to learn that she needs to say what she wants. You're not a mind reader. Now, you need to say these things with compassion. When she attempts to re-engage, and this is very common when a pregnant woman is very emotional, she is probably going to try to re-engage and say something like, why are you walking away? Stuff like this. Your response should be very tempered and calm. I am here to help you, but if you don't need anything, I don't want to upset you, and I don't want to get upset myself. So I am removing myself from the situation. Now, this is a learning curve for a lot of couples, okay? Because I'm not going to say the partners don't have mood swings also. This is something that requires practice, but there's no point in engaging in a conversation that's going nowhere. And certainly screaming at each other isn't helpful either. But what a lot of people also don't understand is that a pregnant woman does not have the right to verbally attack you for no reason. So if she's having a mood swing, you want to show her compassion, but you don't need to be subjected to verbal abuse or attacks simply because she's pregnant. So that's why I usually recommend that you remove yourself, but you stay offering. If you need something, let me know, send me a text, whatever. Okay. And then maybe get lots of ice cream for the house. Maybe that'll help. We're getting close to the end. Remember, if you guys have any questions, please throw them into the chat. We got another comment on our Breastfeeding While Pregnant video, and this came from a father, and I thought it was fantastic, so I wanted to share it. I thought that pregnancy poisons breast milk, which could be dangerous for babies. That was my understanding before, but I learned a lot from you, especially through your answers to different comments. My wife is 1 month pregnant with a 7-month-old baby. I think she will feel solace in this video after her sleepless nights. So what are they referring to? So a lot of women choose to breastfeed while they are pregnant, okay? And this can be for a variety of reasons. This can be because they only have access to breast milk. This could be because they have a medically fragile baby who does better using breast milk than, say, formula. This could be because they didn't realize they were pregnant. It could be for a variety of reasons. When you breastfeed while pregnant, it's safe. Okay, this is what women did for hundreds of thousands of years. We didn't just have formula on a shelf that we could grab. So if we happened to become pregnant and we were still breastfeeding, we breastfed. Now, is there sometimes a reason why you shouldn't breastfeed? Of course. So breastfeeding, when the milk comes out, your body releases a hormone called oxytocin, which we're kind of familiar with for a couple different things. But one of the things oxytocin does is it's the milk ejection reflex hormone. So what does that mean? It tells the milk to spray out, okay? So this hormone, oxytocin, also tells your uterus to contract, which is what helps with labor, right? So when you are pregnant and you're breastfeeding, when the milk lets down, it is possible to feel cramping. This could be a reason why you cannot breastfeed during pregnancy. If you have a high-risk pregnancy where you're at high risk for preterm birth, your doctor is going to tell you to stop breastfeeding, and you should, okay? It is a high risk. However, if your risk is low, there's no reason why you can't continue to breastfeed unless you develop some kind of complication along the way. Now, the biggest reason why you can't breastfeed is not because the milk is poison. It's not. It's the same milk. But about halfway through most women's pregnancies, the milk will change from regular mature milk to colostrum, that first milk that a baby has. Now, regular mature milk, you can make 6, 8, 10 ounces every 3 hours out of your breasts. But colostrum is like a teaspoon. So if you've been feeding a baby only breast milk and you've been making this mature milk at high amounts, and then all of a sudden your milk dries up and now you have colostrum, your baby is going to go hungry. So when you're nursing a baby, especially a baby who might not be eating any other foods, you need to keep an eye out and make sure the baby is still peeing and pooping normally. Now, if you have a baby who is over the age of 1 and eating table foods, it's not going to be a big deal if your milk dries up because they're getting all the nutrition that they need. If your baby is between 6 months and a year where they're getting some table food, but not enough maybe to do the whole diet, you're going to want to supplement with formula. So you keep an eye on the baby's pee and poop, and you keep an eye on the baby's weight. Our last comment that came in was about fear of pregnancy, which is a very real thing, and I think it's very important to address. For many years, I've been afraid of childbirth and all the disadvantages it can bring. But after I had a traumatic insertion of an IUD, this fear has become much worse. I don't trust medical providers at all and have been gaslighted several times to do things I didn't feel safe about, and they didn't listen to me about my fears. I don't know how I will ever be able to trust them while knowing that I want children in the future. I feel so alone in my experience since none of my friends have this problem and just keep telling me I'm overthinking. So I thought this was a really articulate comment that really highlighted how fear of pregnancy is a real thing. And what I'll tell you is if you're suffering from fear of pregnancy, you want to make sure that you start looking at therapy. And in this case, you may even want to experience EMDR therapy, which is a special type of therapy for trauma. And it's important for you to understand that therapy can help you work through some of these fears. It can also allow you to become comfortable with other options that maybe in the past you hadn't considered. For example, adoption, fostering, using a surrogate. These are all options that can help you become a parent without being pregnant yourself. And it's okay that you're fearful. What we want to do is make sure that the fear isn't taking over. And for any of you who know somebody who might be afraid of pregnancy, try not to dismiss them. These fears are a real thing for them. And the more they feel dismissed, the less likely they are to engage in the process. But when they feel like they're supported, they're more likely to start to listen and engage in things that might help with that. So we're at the end of our live. My name is Dr. Samantha. I'm the maternity mentor. Thank you so much for joining us. I really appreciate it. We're here every Monday at 9 p.m. Eastern Standard Time to answer all of your questions live, as well as any questions that you've submitted onto the channel on our videos. Please share the channel with your friends and family. Follow us on Facebook, Instagram, and Twitter for additional content. Those will be linked in the description. And please make sure you like and subscribe. It really helps us out when you subscribe to the channel. And we really appreciate you guys all so much. So without further ado, I'm going to end the stream for tonight. We really appreciate you. Thank you so much. I'm Dr. Samantha. Bye for now.